Hello.
Stand right there, Doctor.
Oh, I'm sorry. Feel good? I thought it was a bit tall. Good. So today we can report 7 new cases of COVID. These cases have been identified from overseas and in hotel quarantine. 2 of these cases are directly related to another gentleman who tested positive on the Qatar flight. Another 5 are from the Ok Tedi mine. We are concerned about the number of positives cases we're seeing coming in on those chartered flights from the mine in Papua New Guinea. We might put that down, I think. I think that's going to keep dropping. Yeah, that's okay. Yeah, we might, because it just keeps leaning forward. We might just move them. Thanks. So, as I was saying, we are concerned about the positive cases coming in on chartered flights from the mine in Papua New Guinea. We have been advised that the mine has suspended these flights for the next 2 weeks, and we welcome this announcement to ensure that we don't have an abundance of positive cases coming in, particularly to Cairns, which is where these individuals are being treated at the moment. In relation to the Qatar flight, 74 people have already been requested to extend their hotel quarantine until just after midnight on Monday, so they can do a test 14, a day 14 and a day 16 test to ensure that we don't have any additional cases. We do already have 6 cases from that flight that we're aware of. We are also, out of an abundance of caution, as 2 of these cases were in rooms next to each other in the Mercure Hotel, we are asking for the 8 individuals who have left between the 18th and the 21st of February to get tested and to isolate themselves until they get their results and until they've had 14 days since they left the hotel. Now, for a number of them, their 14 days will be today or tomorrow, but we just want them to get tested and quarantine until they have their results. And the latest will be anyone who left on the 21st will have to wait till just after midnight on Monday, not just for their results, but to make sure that they're absolutely safe. This is an abundance of caution. The most likely scenario is that these individuals were either positive before they got onto the plane, as we believe some of them definitely were, and others have contracted it on the plane. But we do want to be just absolutely safe in making sure that the 8 people who have left floor 8 at the Mercure Hotel between the 18th and 21st do get tested and do isolate themselves for a period of time. It is great to see our vaccination numbers climbing. We've had 5,409. We set ourselves a target of 3,000 by the end of this week. We have already hit that target of 3,000 already by the end of yesterday. So I'm thrilled, and I want to acknowledge all of those hospitals. The Sunshine Coast University Hospital, I was there at 6:30 this morning. They've gone live with their vaccination hub and they've booked in 120 people to get their vaccine today. And they include paramedics, police officers, nursing staff and also environmental cleaners who do the deep clean amongst other frontline workers. And I met some of them this morning. Sasha, who works in the fever clinic, who was the first to get her injection, and Ian, who works in the environmental area and does the deep clean. So the last one to come in of our 6 hubs will be Townsville, and that will come online tomorrow. And I'll be up there visiting them tomorrow, as well as the Cairns vaccination hub. We are working through at the moment when we will go online with additional hubs, which we expect in coming days. We're in relation to the AstraZeneca, but we're just waiting for the AstraZeneca to get here in Queensland to know exactly the volume we're getting and where before we open up those new hubs. I'll hand over to Dr. Young now to just talk a bit more about those 7 cases and what we're doing in relation to those individuals we'd like to come forward and get tested. Dr. Young.
Thank you very much, Minister. So 7 new cases overnight in Queensland, all of them in hotel quarantine. Now 5 of them are related to the Octedi mine, and we've been working with the Octedi mine to work through that because we've seen a lot of positive cases come from there. Most of them have been treated in Cairns, and that's pushed their resources. So the Octedi mine management have been excellent, and they've cancelled the flights that were planned over the next week or so we can work all this through. Of the 5 new cases related to the Octedi mine, 1's already being treated in Brisbane, the other 4 in Cairns, and we're just working through with Cairns whether we might move some of those positive cases down to Brisbane through one of the aeromedical planes that we have, just to assist Cairns. So there's that issue. Then the other is that we have 2 new cases related to that Qatar flight that arrived into Brisbane very late on the 17th of February, around 9:45 p.m. that day. So there are now 6 cases. 1 of the people transited on to New Zealand and is in New Zealand now. Then another person tested positive who would have had it at the time they were on the plane, and they were infectious on the plane. Now, they've then given it to 2 other people at least. One of them, we're confident, happened on the plane. The other one, I'm not as confident. It could have happened, unlikely, but it could have happened in the hotel because this person was in the room next to the person who was positive. So just because I'm just being very cautious about this, I've now asked that the 8 people who are on that floor, floor 8, in that hotel, get tested again and remain isolated until they get the result. And also for those who left earlier to remain in their homes or wherever they are for 14 days from when they left the hotel, just because I'm not 100% certain about the transmission at this stage. So we now have 3 people from that flight with exactly the same genome. There's no difference at all. So those 3, 2 of them have got it off one person. I'm just not quite sure where those 2 people got it. Then we have those 2 new cases this morning, and they're clear cases. They're 2 people who've got it off one of those other person who was in the same room. So those 3 people who have it were all in the same room, a family group. So that's not an issue. So we're just working through with the hotel about what needs to happen. The hotel has been absolutely brilliant. They've managed this all beautifully, and the most likely situation, as I've said, is that there's been transmission on the plane. So that's why I have gone and asked those 74 people who were on that plane to remain in quarantine for an extra 5 days so we can subsequently test them, as we have with these ones that have just come through and picked up positive. So that is an ongoing concern, but it's not a concern for the general population because, as you know, we keep people in hotel quarantine who come from overseas. 8. Yes. Yeah, we're working through that at the moment, exactly where they've gone, when they left and what they need to do. So it's 8 people.
Did they leave over a number of days?
Yes, between those. These are people who have been in the hotel for that period of concern, which is the 18th, when that flight arrived, into the hotel. They arrived late on the 17th. So they were in the hotel, very early hours of the morning on the 18th. And then the gentleman I'm worried about, who's been a particularly infectious person, left there on the 21st. to go to hospital. So the period of concern is the 18th to the 21st. So anyone who's left that hotel 18th through to 21st, I'm worried about 8 people.
And
Yeah.
to just clarify, it's been 5 people in total now linked back to that one.
6 people. 6 people.
And is it 3 people who've confirmed to have the Russian variant?
Yes. Remembering though the Russian variant per se is not an issue. It doesn't have any of those mutations of concern. So it's just a variant, but it's not a particularly contagious or problematic variant. The problem with it is not the variant, it's the one individual. So, you know, through this pandemic we have had instances of super spreaders. I'm concerned that this individual is a super spreader. I'm not concerned about it being the Russian variant. It's just another variant, no different to others.
This person you're worried about, he has the Russian variant.
Yes, but that's not the issue. So we've had plenty of people throughout the pandemic who've been super spreaders. We had one individual who managed to spread it in a few hours to 40 other people, for instance. So we've had super spreaders all along from day one. We still don't understand fully why one person spreads the virus to someone else, or indeed to many other people, and another person doesn't spread it to anyone else. So it's the fact that there's been spread on that plane. There's no doubt about that. That is the concern. It's not that it's a Russian variant.
Are you concerned that you may have to lock down certain areas given that 8 people who left the hotel between those 3 days have been out in the community?
I need to find exactly where those 8 people have been. Some of them might have gone overseas, some of them interstate. They could have gone to anywhere. These were people who did their hotel quarantine in that hotel. And remember, anyone who comes into Australia quarantines in their first port of arrival. So we manage quarantine for people who usually live in Victoria, Northern Territory, indeed people who then go on overseas. So I just need to find out where the 8 people have gone. I think it's unlikely that it's a risk, but it is a risk, no matter how small, so I just want to work that through.
So you've had to notify the state and overseas authorities?
Yep. So I've let the National Incident Room know, so they're aware.
And just in regards to the vaccination rollout, there's
Yeah.
obviously that better choice of words, bizarre tweet overnight about defending Queensland Health's seemingly slow rollout of the vaccine. Firstly, why that tweet, and are we behind compared to other states?
I'm afraid I'll be embarrassed to say I don't tweet, so I don't know about the tweet. I do know about vaccine though, and we're doing really, really well. We've stood our hubs up as we planned. We always planned in Queensland a slow, methodical start to make sure that we got every issue ironed out, because I didn't want any errors being made at any stage, and each area has done a just first-class job. That's rapidly happening, and then the numbers are going up. But we started with one hub on day one, then we brought another one on the Wednesday, another one on Friday, 3 more this week. So you would expect that's how it's going to go, and that was always the plan. So from my point of view, it hasn't been a slow rollout, it's been a perfect rollout.
How many doses does Queensland have of the vaccine?
I don't know, we were expecting some AstraZeneca, so I don't know if that's actually arrived yet. See, this is, yeah, the Pfizer we've received around 10,000 per week, and that's going to increase in week 4. So this is all very uncertain in terms of the actual dose numbers, because it's uncertain how many we can get from overseas. I mean, the Commonwealth has done a first-class job securing this vaccine for us, but they have had difficulties working out how much we're going to get. And I didn't want to go and ask people to come forward and get vaccinated if I didn't know if there'd be vaccine to give them. That would just frustrate everyone. And we're so lucky here in Queensland, we don't have community transmission, so there's no rush. So we can do this methodically and effectively.
Do you expect to start delivering the AstraZeneca vaccine?
Hopefully very, very soon.
But no specific date?
Well, we need to get the vaccine before we can commit to the date. But I understand that's happening very soon.
By early April, all of our hotel quarantine records will have received the first jab if everything goes well. Does that mean that we really need this proposed quarantine
It depends on how many people the Commonwealth wants to bring back into Australia. So if they want to bring more than are currently coming at the moment, we will need more capacity. And then that's an option that the Commonwealth might choose to use. But really, it's a Commonwealth decision. They're determining the numbers of people who are able to come into Australia.
Mine is coming back from PNG. How many have been coming back on flights from PNG into Queensland?
Significant numbers. They've been on charter flights, so they've been coming through that way. Yeah. Yes, hundreds.
And how many in total now got the virus?
Out of that number, I'm not sure, but I know out of the whole mine site, their local people and expatriates, it's over 500 have already been infected.
Just a question for the doctor. Do you stand by that tweet that we picked on our vaccine rollout?
Oh, look, Queensland Health put the tweet out, and I think, what it shows is probably a bit of frustration. There was some reporting at the start of this week saying that Queensland was falling behind and slow in its rollout. None of that's accurate. As Dr. Young has said, we planned a staged approach. We started with one hub. Day 3 we opened another. Day 5 we opened another. We opened Sunshine Coast today, and Townsville will be tomorrow. So we've done this in a very measured, controlled way so that we can make sure all of the staff are trained up, that all the procedures are in place, that we know exactly what needs to be done and how it's to be done. I am extremely proud of the staff, right through from the administrative staff organising the booking and the check-ins, to the nurses, to the doctors who are overseeing this vaccination rollout. The only comment anyone should be saying in Australia is how great every state and territory is doing in the rollout of this vaccine.
You just said it wasn't true with the vaccine rollout had been slow. Didn't the Premier, in her own words, say that the rollout would be a very slow process?
We did, but the reports are that somehow we were falling behind what was expected. We set ourselves target. We have met every target we have set. Last week we said we wanted 2,000 by the end of the week. We hit 2,030. At the start of this week I said I wanted 3,000 this week. We have already hit 3,000 as of yesterday afternoon, and we've still got 2 more days to go. So we are meeting our targets and exceeding our targets. What we shouldn't be doing is trying to compete with other jurisdictions. Everyone's different as to how they're going to roll this out. The most important thing is we do it in the phases we've agreed to. We do it in a safe and effective way, and that has to be paramount. We saw what happened with aged care last week. We want to make sure that where we are controlling the administration of this vaccine, we're making sure all those measures are in place and that people can have absolute confidence to come forward and get the vaccine. And I saw so many people at the PA today and at the Sunshine Coast University Hospital all eagerly lining up to get their vaccine. Sorry? I haven't set the target for next week. Everything's dependent on how much vaccine we get, and also whether AstraZeneca comes online. So we're waiting to see if AstraZeneca is arriving in the next day or two, and how much we're getting and where that's going to be distributed, so we can stand up extra hubs and start rolling out AstraZeneca. And of course that will be rolled out again to the 1A group and moving into 1B. And of course the Commonwealth are looking after the aged care residents and workforce. So we'll work cooperatively with the Commonwealth and the states and territories to get the best outcome we can. We want this to be absolute success. We need it to be an absolute success, and the public can have absolute confidence in the way this is being delivered.
Are you confident about
Does this affect the rollout of the vaccines public?
Does what affect the rollout?
The slow and steady approach?
No, because this is exactly as we planned. This is as we planned, and in fact it's what we agreed to with the Commonwealth. We said we were going to do 6 hubs to start with. It's part of the agreement with the Commonwealth that we'd have 6 hubs, and we always said we'd transition them. So no, there's no delay, there's no lag. It is exactly as we have planned, and we are really excited and thrilled and proud of the work that everyone's doing to deliver on those commitments. Sorry.
And are you confident that the hotel processes, the cleaning processes are robust enough, given that there are,
concerns over if it may have transmitted to someone in another room?
Sure, and as Dr. Young said, this is an abundance of caution that we're going to notify and find out where these 8 people are and ask them to get tested again and to quarantine. But let's remember, since this occurred, so the 17th to the 18th to the 21st of February, we hadn't even rolled out the vaccine yet. There wasn't one person in Australia who'd been vaccinated yet since this happened. So, things are moving along, and, it's great to see our hotel staff being vaccinated. But the great news is, since what happened earlier this year, is every single hotel quarantine staff member gets tested every shift. So we now know every shift someone's getting tested, they're all getting tested, which gives us absolute confidence that any staff that has worked over those days have not tested positive at this point. And that's not something that was happening a year ago or 6 months ago. So we believe those systems has made it more robust. We've put extra measures in place. Our cleaning team do an incredible job, and I have confidence in the system.
Should a government health body actually be tweeting and playing politics about something that's...
Look, that's up to Queensland Health. But I don't control what Queensland Health put out, and I don't tell them what to put out. That was a decision that they put that tweet out. I only became aware of it when someone actually sent me a text about it last night. Look, I read that and I thought what that tweet shows me is frustration. Frustration that the Queensland Health workforce have been working so hard, tirelessly for 12 months, and now have stepped up and delivered the vaccine the way we have asked of them, and they're frustrated at what they saw around the commentary at the start of this week. So what I saw was people who are frustrated that they're being criticised for delivering on what we promised in the way that we promised, in the numbers that we promised. So my message is simple. Let's get behind our health workers, as we have done from day one, and let's praise them for the work they're doing, because they're doing an amazing job. Thanks, everyone.
We've got to do this quick.